Let's talk about tumor lysis syndrome or TLS. Tumor lysis syndrome. What are the risk factors? What are the clinical features? And how to prevent and treat a patient with tumor lysis syndrome? First, the risk factors. Tumor lysis syndrome happens with tumors that are bulky, big-sized tumor, or the tumors that are chemosensitive. So the tumors such as leukemia, lymphoma, and bulky germ cell tumors are common cause of tumor lysis syndrome, because those tumors, when you give a high dose of chemotherapy, there is a massive lysis of the cell, and that releases multiple intracellular contents. So that is given in the features. So whenever you give this high dose chemotherapy in a highly sensitive tumor with high bulk, then there is lysis of a massive number of cells. And there is hyperkalemia because potassium is coming out, uric acid is coming out, phosphate is coming out from inside the cell. So those will cause hyperkalemia, hyperuricemia, and hyperphosphatemia. And whenever you have hyperphosphatemia, that will reduce the ionized calcium level, causing hypocalcemia. So whenever you have those electrolyte abnormalities, they can have some complications. So high uric acid level can lead to precipitation of the uric acid crystals inside the renal tubule, leading to an acute kidney injury. A high potassium level can cause cardiac arrhythmias. A low calcium level can lead to tetany and seizures. So how to prevent and how to treat a patient with tumor lysis syndrome? First, prevention. We want to identify patients who are at high risk of tumor lysis syndrome, and that is held by the bulk of tumor and the type of tumor. Additionally, we can do an investigation such as LDH. If the LDH is high, that suggests a high risk of tumor lysis syndrome. If there is a high risk of TLS, we hydrate the patient, we start IV fluid 24 hours before the chemotherapy, and we try to maintain a good urine output. And we also give an uric acid lowering agent such as allopurinol, or even better is giving rasburicase. And after the chemotherapy, we monitor the patients for 48 to 72 hours. And the monitoring is by clinical evaluation and also by electrolytes. One of the most common or earliest electrolyte change that we see is potassium change or hyperkalemia. We also monitor the renal function test. So if there is evidence of AKI, we have to start dialysis at an early stage to prevent irreversible renal damage. So that's all for tumor lysis syndrome. In summary, tumor lysis syndrome occurs due to lysis of tumor cells, especially leukemia, lymphoma, and germ cell tumor, which are highly chemosensitive, leading to release of cellular contents into the blood, causing hyperkalemia, hyperuricemia, hyperphosphatemia, and hypocalcemia. The hyperkalemia causes cardiac arrhythmia. The hyperuricemia causes renal injury, and the hypocalcemia causes seizure and tetany. The prevention is by risk stratification by doing LDH, giving IV fluid 24 hours before starting the chemotherapy, maintenance of adequate amount of urine output, giving uric acid lowering agents such as allopurinol and rasburicase, monitoring the patient after chemotherapy for 48 to 72 hours, especially with renal function test and potassium, and giving the patient dialysis whenever we have renal injury.